It's a pretty obvious warning plastered front and center in uptown Charlotte and all over social media that Charlotte is in the middle of a hepatitis A outbreak. The signs are hard to miss right now, and health officials say that is the point.
Yes, there have been more than a dozen new cases of hepatitis A since a scare at a West Charlotte restaurant in June. The most recent case diagnosed just this week. Eyewitness News reporter Elsa Gillis spoke with the health director, who says this outbreak is serious and getting the word out is crucial.
This sign is hard to miss, and that's the point. The county is really trying to get the word out about the hepatitis A outbreak before it gets even worse.
We continue to have new cases, so we know it's not gone away.
It was back in June when the CDC declared a hepatitis A outbreak in Mecklenburg County. We're now in August, and the county health department director told me it's still going on. There have been 13 confirmed cases since April, and all of the patients were hospitalized. It was just this Tuesday when the latest person was diagnosed with a highly contagious liver disease.
The Hardy situation happened because of this outbreak.
We first told you in early June of 5 confirmed cases. At that time, officials said the general public wasn't at risk. In late June, a Hardee's worker was diagnosed with the virus, and there was a push to have everyone who ate at the West Charlotte restaurant during a certain period vaccinated.
The time that the general public's at risk is if we have another situation like the Hardee's. And if we have more and more cases of hepatitis A, that's likely to happen again.
So that's why you're seeing banners like this and messages on social media.
So I think that's always a good sign when where you live and they're doing things that will help keep the community safe.
What happened just recently with that restaurant and everything, they need to get it out as soon as possible.
Harris says a big reason behind this wide outreach is what they're seeing in other parts of the country.
Kentucky has had over 800 cases. Many of those have been hospitalized. There have been some deaths. We don't want that in Mecklenburg.
Education and prevention is really what the county is focusing on with this outbreak. We've posted a link with everything you need to know on our website, WSOCTV.com. Reporting in Uptown, Elsa Gillis, Channel 9 Eyewitness News.
It is important to note certain populations are more at risk. The health department tells us the homeless population, those who use illegal drugs, and men who have sexual encounters with other men are most at risk. Now, you need to know exactly what hepatitis A is and know the symptoms to look for. Hepatitis A is a liver infection. It can range from mild to severe. Some symptoms can appear suddenly, and they might include a fever, fatigue, and nausea. It can last for several weeks, and in rare cases, it can cause liver failure or even be deadly.
Well,